Back when I was in Syria in 2012, I was detained because of my involvement in providing healthcare to pro-democracy demonstrators. So I believe once I get back to Syria, I will be detained, like even on the border or in the airport.
Syria has had an intentional policy of attacking the healthcare system, including the bombing and destruction of hospitals and health facilities, and also the killing, arrest, and torture of health professionals. Certainly, in the 40 years where I've worked in human rights, we have never seen such an intentional, all-out, systematic assault on healthcare as we have witnessed in Syria. It has not been in the front lines of the news in months. It's sort of now becoming almost a chronic and/or forgotten conflict and post-conflict situation. It's still one of the most serious humanitarian crises in the world. There are different entities that are controlling different quadrants of the north. A third to a half of the population of Syria do not have access to a proper functioning healthcare system at all, where many are displaced and where people are finding it very, very difficult to get care in a hospital or health facility. So people, especially women and children, as well as those who are physically or emotionally disabled, are suffering, and many of them are at risk of not surviving.
Right now, for example, in northwestern Syria, we have around 4 million people served by 600 physicians, which is way below the threshold for healthcare according to WHO, World Health Organization. And this is basically because of the deliberate targeting of healthcare facilities and the detention and killing of healthcare professionals.
One of the things that's very striking about access to health and healthcare in the northern region in Syria is that we see a blockage of humanitarian aid, medicine, vaccine access to whole swaths of the population. If that one remaining lifeline were to be closed, it would be catastrophic.
I don't think I can describe it better than what most physicians that I interviewed describe it as, a death sentence to people in northern Syria.
An NGO administrator in Idlib said, "This is the window through which we breathe. If you close the window, we'll suffocate."
And on top of all this, the COVID-19 global pandemic play a role in making the situation even worse. Medications are not available in northeast Syria because the Syrian government is the only supplier for these medications. A physician told me, in northeast Syria, we surrendered to the COVID-19. Whoever will die, will die. There's nothing we can do for them. And whoever will live, then there might be a different disease that would kill them.
The humanitarian crisis in Syria has, at its core, a human rights crisis. If you occupy territory and you are exerting administrative control over a population, you are responsible for their well-being, and that includes their right to health. And Physicians for Human Rights will always stand by its colleagues in the medical field and defend both the individuals providing health care and the population's right to access that health care.
I feel like I have the opportunity to shed the light on different crimes that were committed inside Syria and push harder and advocate more toward impactful response to the Syrian crisis.